Hey everyone, I'm Dr. Rezaian, specialist in arthritis and rheumatology. Today, we're diving into one of the most exciting breakthroughs in autoimmune medicine this year. Rinvoq, the once-daily pill that's been making waves in rheumatoid arthritis and other conditions, has just received FDA approval for giant cell arteritis. But does it live up to the hype? Let's break it down. Before we begin, this video is for education and inspiration only. For medical advice, please consult your physician. Giant cell arteritis, or GCA, is an inflammatory condition that affects large and medium arteries. Most famously, the temporal arteries right here on the side of your head. It's typically seen in people over 50 and can cause headaches, jaw pain, vision loss, even strokes. And if it overlaps with polymyalgia rheumatica, you've got widespread stiffness and fatigue to boot. The treatment: steroids, lots of steroids until now. On April 29, 2025, the FDA officially approved Rinvoq, that's upadacitinib, for adults with giant cell arteritis. That means for the first time ever, we have an oral targeted therapy, not an injection, that's proven to reduce inflammation, achieve remission, and help patients get off steroids faster. Let's talk about how this actually works. Rinvoq is what we call a JAK-1 inhibitor. Think of it as flipping the circuit breaker on your immune system's overactive wiring. It blocks the JAK-STAT pathway, which stops inflammatory signals like interleukin-6, interleukin-12, interleukin-17, and interferon gamma from lighting up your arteries like a wildfire. Bottom line, less inflammation, less damage, and hopefully, less need for prednisone. This approval isn't just pharma buzz. It's based on real data from the SELECT-GCA Phase 3 trial. Here's what they found. 46% of patients on Rinvoq achieved sustained remission at 1 year. That's compared to only 29% on placebo. Complete remission rates were 37% versus 16%. And the steroid dose, way lower in the Rinvoq group. Mean total was 2,283 milligrams versus over 3,300 milligrams in the placebo arm. Translation: better disease control, less steroid exposure, and fewer side effects. Now, no drug is perfect. Rinvoq comes with important safety considerations. We watch for infections, including shingles, blood clots and cardiovascular risks, elevated liver enzymes and cholesterol. So patients need regular lab monitoring, a TB test before starting, and a detailed discussion if there's a history of heart disease or cancer risk. Rinvoq might be right for you if you've relapsed while tapering off steroids, didn't tolerate Tocilizumab, want an effective oral therapy without injections, or if you've got polymyalgia rheumatica overlap and you're still flaring. As always, this should be a shared decision between you and your rheumatologist. Quick comparison time. Tocilizumab is an injection. Rinvoq is a once-daily oral pill. Tocilizumab targets interleukin-6. Rinvoq blocks multiple inflammatory cytokines. Both are FDA approved. Now patients have a real choice. So what's the takeaway? Rinvoq is a game changer. It's the first oral medication approved for giant cell arteritis that tackles the disease head-on. It reduces steroid dependence and opens the door to more convenient, targeted care. But with power comes responsibility. Monitoring is essential, and it's not for everyone. Still, for the right patient, this could mean better quality of life and long-term control. If you learned something today, give this video a like. Subscribe for more cutting-edge rheumatology insights. And drop your questions in the comments. Stay strong, stay informed, and I'll see you in the next one.